name is Miranda Treadway, and I'm a registered nurse. I work on a busy hospice floor that requires a lot of one-on-one nursing care. So the topic that I'm going to discuss today is really close to my heart. I would like to discuss nursing staffing, but specifically I would like to discuss nursing staffing and patient acuity. My question is, should patient acuity dictate the type and the number of nursing staff available on your unit? Any nurse that has ever worked a busy med-surg floor or a long-term care unit or even an end-of-life unit would agree that no patient's needs are created equally. And this is where patient acuity comes into play. Patient acuity can be defined as the measurement of the intensity of nursing care required by the patient. So when determining a patient's acuity level, the nurse should ask the following questions. What is the patient's age? What is the patient's medical diagnosis? What is the severity of their illness? Do they have any comorbidities? What is their socioeconomic status? What is the patient's ability to provide self-care? And lastly, what is their anticipated length of stay in the hospital? Asking these questions provides the nurse with critical information that she needs to assess the patient's level of acuity. A little bit later, I'm going to discuss with you an acuity-based staffing methodology. Better RN staffing levels have been associated with reduced patient mortality rates, enhanced patient outcomes, and enhanced nursing and patient satisfaction. One study found that for each additional patient that was assigned to a nurse, that patient had a 7% increase in the likelihood of dying in the next 30 days from admission and a 7% increase of failure to rescue. That is a big deal, especially if you're that patient. Despite abundant research, safe and appropriate nursing staffing remains one of the toughest problems for hospitals to manage. And why is this? Most nurses would argue that their employers do not want to spend the money to adequately staff the unit, while employers may argue that if their nursing staff showed up for work or worked at 100%, that the floor should be covered appropriately. But regardless of which side of the argument that you are on, all nurses are accountable to their patients and to the profession of nursing. As an RN, you are in charge of that patient and their care, and that is a huge responsibility. It is your responsibility to know what is needed with staffing. The American Nursing Association speaks to this. They state that nurses, as members of a knowledge-based health profession, must answer to patients, to supervisors, to the board, and to civil or criminal court systems when the quality of patient care provided is compromised. So no matter the workload of the nurse is still responsible for the care provided to that patient. So should nursing staff push for acuity-based staffing? The research indicates that the answer should be yes. So exactly what is affected when the nurse has more patients than she can appropriately and safely provide care to? Indicators affected include increased risk for catheter-associated urinary tract infections, increase in patient falls, new occurrence of pressure ulcers, which we know that new occurrence of pressure ulcers can be considered a form of neglect, IV infiltration, nosocomial infections, patient restraint use, pain management. Pneumonia is a big area of emphasis here. Not getting our patients out of bed in a timely manner or enough can definitely increase the risk of pneumonia. Failure to rescue and longer lengths of stay. Many aspects of nursing care are neglected as the workload increases. A study shows that nurses say that they neglect comfort talks with patients and with family, documentation of nursing care, oral care, catheter care, changing IV fluids out on time. Nurses state that they feel that their job is more task-oriented than patient-oriented, which is not the goal of nursing care. These are all unwanted patient outcomes. So what can be done to prevent these occurrences from happening? An acuity-based staffing system regulates the number of nurses on a shift according to the patient's need and not just according to raw patient numbers. Patients may range from needing minimal care on the day of their discharge to needing maximum care if they were to suffer from a negative event that has led them to the intensive care unit. Now there are systems that can assist nursing supervisors into using acuity-based staffing modules. Acuity-based staffing systems can help a nurse manager determine the best core staffing pattern for every shift based upon patient data. At one time, acuity-based staffing relied on paper checklists, but now, as many of our medical records are computerized, nursing staffing can document the patient care, and the nursing supervisor can print a report from that, and they can see what is needed as far as the nursing staff according to patient acuity. When the report indicates that patient acuity is likely to be high on the next shift, the nursing supervisor can either call in a float nurse or she can offer overtime to her nurses. And not only can you increase the number of nursing staff, but you can increase the skill set of the type of nurses that you need. Cognitive skills and knowledge that are crucial in expert nursing care, you can bring in those nurses to provide the care to the patients with the highest acuity need. Patient classification systems and acuity tools allow managers to predict staffing needs and more accurately control nurse-to-patient ratios. All of this is done to increase patient satisfaction and patient needs, along with satisfying nursing needs, being able to get all of their work done and to appropriately provide care. Every system is going to have positive and negative feedback. Feedback from nurses that have used an acuity-based patient classification system in the past has been strengths include the nurse stated that it should help with making fair assignments. The nurse thought that the strength is in the acuity measurements. And this is my favorite. It shows what is really wrong with the patient, and that is a huge deal because a patient may have many comorbidities and they may have a long list of medical diagnoses. But to know exactly where you're spending most of your treatment time, most of your nursing time, is critical in knowing how to appropriately take care of that patient and how to get them healed and to get them home, which is the goal. Weaknesses include some nurses felt that all information is not effectively captured. They felt that they were unable to avoid one nurse being assigned higher acuity levels. And I could definitely see this as a problem because your more veteran nurses or your nurses with a higher skill set would have the higher acuity patients frequently. And if this were to happen, then maybe that nurse could take a newer RN under her wing, teach her a little bit more about specific illnesses and how to treat these types of cases. Another nurse stated that she thought it took too long to complete the data. But if you're completing your nursing documentation, that should be all of the work that's needed for the nursing supervisor to get the information to appropriately assess the situation. So in conclusion, no matter where you work, nursing shortages are likely to continue, and staffing continues to shift towards less registered nurses. It's timely for the nursing managers to consider patient acuity. Nurses can advocate for acuity-based staffing in their places of employment. No one method will fit every single unit, but research shows that acuity-based nursing staffing supplies the patients with appropriate nursing staff and skill level that meets their need. The entire goal is to meet the patient's needs and to provide them the best care possible. This method of matching patient needs to staff abilities on the basis of data and evidence is crucial in preventing negative outcomes and ensuring that patient needs are met appropriately. Thank you so much for your time.